As a patient, what is the dumbest thing a doctor has ever recommended that you do? My daughter Rosie was 6 when she started limping around the house. At first I thought maybe she twisted her ankle at the playground or something. Kids are always falling and getting bruised up, right? But then she started crying about her legs hurting, especially at night. She'd wake me up at 2 a.m. sobbing that her bones felt like they were on fire. I'd give her some children's Tylenol and rub her legs until she fell back asleep. This went on for about a week before I decided to take her to our pediatrician. Dr. Mitchell had been our family doctor for 3 years. He was this older guy who always seemed rushed, like he had somewhere more important to be. When I brought Rosie in, he barely looked at her for 5 minutes before giving his diagnosis. Well, she's carrying some extra weight, he said, looking at her chart. Kids her age should be running around more. Put her on a diet and try getting her outside more often. The leg pain is probably just from the extra strain. I stared at him. Sure, Rosie was a little chubby, but she was active. She rode her bike every day and loved playing at the park. But Dr. Mitchell was already writing something in her file and moving toward the door. But she's crying in pain every night, I said. She can barely walk some mornings. He turned back with this annoyed look. Kids exaggerate. She's probably trying to get attention or avoid school. Just stick to the diet plan. I left feeling confused, but figured maybe he knew something I didn't. So I started packing healthier lunches for Rosie and taking her to the park every single day after school. But nothing changed. If anything, she got worse. 2 weeks later, Rosie couldn't even get out of bed without help. Her little face was so pale, and she kept saying her legs felt heavy. I called Dr. Mitchell's office and managed to get another appointment. This time he seemed even more irritated when I walked in. He didn't even examine her properly, just looked at her walking and shook his head. "You're overthinking this," he said. "Kids make stuff up all the time. She's probably learned that complaining gets your attention. Maybe she doesn't want to go to school." "She loves school," I snapped back. "Something is seriously wrong." He gave me this patronizing smile. "I've been doing this for 20 years. Trust me, if there was something serious, I'd catch it. Keep up with the diet and exercise routine." I walked out of that office furious, but second-guessing myself. Maybe I was being an overprotective mom. Maybe Rosie really was just being dramatic. That doubt lasted exactly 3 more days. I was at work when my phone rang. It was Rosie's school nurse, and her voice was shaking. "You need to get here now. Rosie collapsed during reading time. We called an ambulance." I drove to the hospital going probably 80 mph, my hands shaking on the steering wheel. When I got to the emergency room, they had already taken blood samples and were running tests. The ER doctor was this younger woman named Dr. Park, and she looked concerned. "We're going to do a full blood panel and some imaging," she said. "Has anyone checked her white blood cell count recently?" When I told her about Dr. Mitchell's diagnosis, her expression got really serious. 2 hours later, she came back with results that made my world stop spinning. "Your daughter has acute lymphoblastic leukemia," she said gently. "The leg pain was from pressure in her bone marrow. Her white blood cell count is extremely high. I felt like someone had punched me in the stomach. Leukemia. Cancer. My 6-year-old had cancer, and that idiot doctor told me to put her on a diet." Dr. Park explained that the bone pain was actually one of the most common early symptoms in children with leukemia. Any decent pediatrician should have at least ordered blood work when a child complained of persistent bone pain. 3 days later, I marched into Dr. Mitchell's office with Rosie's diagnosis in my hand. His secretary tried to stop me, but I walked right past her into his office. "My daughter has leukemia," I said, slamming the papers on his desk. "The leg pain you dismissed as attention-seeking was her bone marrow being destroyed by cancer cells." For a second, he actually looked shocked. Then he shrugged and said, "Well, it's not like it was obvious. Kids are dramatic about everything. How was I supposed to know?" I couldn't believe what I was hearing. No apology, no acknowledgement that he'd almost let my daughter die because he was too lazy to do basic tests. I filed a formal complaint with the medical board that same day. I also switched to a pediatric oncology team at Children's Hospital, where they actually listened when I described symptoms.